Hi, everybody. BJ Miller here, Palliative Care Doc. We are about to answer sort of the spillover questions, the questions we didn't get to in this morning's webinar on the mechanics of caregiving, that series. So over to you, Sonia.
Thank you, BJ. All right, first question is I'm having a difficult time with my mom knowing that I know better and then following my instructions, especially when it comes to moving, sitting, etc., where I could be injured. Do you have any suggestions for how to get her to follow my instructions or understand that I do know what I'm speaking about?
Yeah, I mean, I'm smiling because at least the image I have in my head is, I've run into things like this in my own life. And I'm smiling because it's oftentimes as emotional critters, even when we know something's right or for the better or whatever else, for other reasons, playfulness, snarkiness, unchecked angerness, all sorts of reasons we dig our heels in and get stubborn and act blah, blah, blah in all sorts of ways. So not knowing your mom, not knowing your dynamic, I guess that's my bias. I'm picturing some dynamics in my own life. So one quick thought would be, it may be your mom is not listening, if that's it in a nutshell, essentially not listening to you, not respecting your point of view on this, not respecting your body, your own safety in this. Of the zillions of things that may drive that sort of dynamic and that interpersonal dynamic, one would be, for patients, it does get exhausting and annoying as hell being a patient, and she may simply need, and autonomy is one of the things that kind of a sense of autonomy can go. Like our body's no longer our own. We're relying on all these other people, and I, the person, can get lost in the mix of being cared for. And so one thing to just check yourself really is there something, is this an indirect demonstration by your mother that she's not feeling seen, heard, she doesn't have a sense of choice or autonomy? She may be looking to dig her heels in wherever she can to just demonstrate herself in this mix, to stake her own claim. So I would check that if that's what's going on, because maybe the answer here is to sit with mom and say, hey, mom, how are you doing with all this? And actually kind of go in the other direction, like listening more to her, letting her vent in a way. And then at the end of that, then you can say, well, Ma, I totally hear you, whatever, blah, blah, blah. But I need you to understand this is, I'm in this mix too. And all these things affect my life too. And I'm here because I want to be and blah, blah, blah. But there's certain things I got to be careful about. Like I have, like for example, I do know like the mechanics of moving a body through space. I'm aware of how to do that, and so that I don't injure myself. So I really need you to hear me, that I know what I'm talking about here, and I need you to work with me, because otherwise I'm gonna throw my back out. You're gonna feel like crap about that, and then I'm gonna be in a position where I can't help you. So that may be the route to go, is sort of first check in with her. This is sort of unprocessed desire for her to stake herself in this mix and stake her own claim versus being this passive recipient of all this other stuff. If that is or isn't well placed, either way, it may simply be you sitting down with her and simply saying, Mama, I hear you, I love you, blah, 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 blah. But I need you to hear me on this because I'm going to hurt myself caring for you. And I know you don't want that. So those are generally kind of safe statements in most family dynamics. Hopefully there's something in those words that you can place yourself.
Okay, next question is a little bit of a story. Let me read all of this out. I have been in end-of-life caregiving for 22 years. It was when I helped my 25-year-old daughter live her last stages of life that the true importance and the gift of communication became clear. It was a gift for her because she got more of what brought her joy before she died and relieved her family of the burdens of decision making and regret. Now, 2.5 years later, I am feeling walloped by the grief, not only the loss of my daughter, but the loss of myself. My
Mm.
identity was so wrapped up in helping her and then helping people to communicate about their end of life preferences, it was easy to not focus on healing myself as her carer, her mom.
Mm. Yeah, well, thank you for this comment question. That cuts to the quick. There's a lot in there. So, Boy, these relationships, especially when it's your child, I can only imagine. I mean, when those relationships shift into a purely internal for you now, like, your daughter is in you, um, obviously that her leaving the planet can leave just an incredible void. Uh, and that can take a long time to kind of reckon with. And in some ways, it's really important to not fill that void too quickly. Um, but sometimes that hole stays a hole. And, and it sounds like from what I'm hearing, you've got sort of, you've got some real grief going on and it may have been delayed. Sometimes there's a latency around grief, especially if I heard you right. If you've been a caregiver for many, many years, in so many ways, this may be old hat to you mechanically in other ways. So it just may take a while for your body and your mind to sink into the distinction here that this is your daughter and to just miss the hell out of her, etc. So it's not uncommon to have a sort of a latent experience with grief or just a protracted one. So simply giving yourself time and space and using the language of grief to give yourself that time and space can be really, really important. And there's no time limit on that. Um, so that's a piece of the puzzle. But you also mentioned here, on top of the sort of this grief, it seems to me, it sounds like there's a little bit of an existential crisis, a crisis of identity, a crisis of meaning. Who am I now? You took on these other big roles. And so when that role isn't really active anymore, what's left? Who are you now? And one thing to note is we are changed by these big experiences. And so you don't hear this in your question, but I would just be careful your goal is not to go from where I sit. Your goal isn't to try to go back to where you were before your daughter got sick, before your daughter died, before you were in that role. Um, of course, that there is no going back in that way. You are, of course, going to have been changed by that experience. And so finding a way to roll with that change is important, but also very hard. So just want to level set in this existential crisis, if that's the right overlay here. I wouldn't look backwards necessarily. I wouldn't strive to go backwards. You can look backwards, of course. We live with our pasts. But look for ways that you are different now, changed now, in ways that you might build upon and celebrate and enjoy. So this feeling of free fall, not knowing who you are anymore, also very normal. Hold that space for a little while. And again, that void, like I'm saying, don't try to rush it in and answer your question too quickly. Because there is an opportunity here as you process the emotions and the psychology of all this, the effect on your psyche. Well, what you are getting in touch with is who are you underneath all of those roles, those achievements, those accomplishments, all those activities, all those relationships. Underneath all that stuff, we are still there's something in each of us that is always there. There is a persona underneath all of the doing. So, but it tends to be a very small and navigable, like a very tiny little thing, a little nub of a person that is just there no matter what we do. But on top of that, a persona is something is so much of an invention, that's informed and filled in by experiences and thoughts and feelings with others, but also your own aspirations. So while you're giving yourself this time and space, you might ask yourself, like, who do you want to become now? On top of this irreducible you that's underneath all this, there is, it may be scary, but the flip side is there's freedom. Now, who do you want to be? So I would push you to see that in a creative way. It can be scary and unknown, but that's so much the trick. And maybe your daughter taught you some of that too, which is you don't always know what's around the corner, but you still go around the corner. And so if you can find that curiosity, that desire to look, to not force yourself to be something you're not, but rather to look and ask yourself, who do you want to be? Checking in with your gut, does this feel right? In a way, you're reborn. I mean, as a mother, you can treat yourself as something of a newborn here. So those are some thoughts. A big question, but I do hope you'll come around to seeing the freedom and opportunity piece of this puzzle. And that's not forced positivity. I just mean that as it's also in the mix too.
Thanks, BJ. Okay, next question. Any tips on being a carer for a grieving family member? My 70-year-old aunt lost the love of her life 2 years ago, and then her dog back in January. A recent attempt to adopt a rescue dog was not successful as it just felt like too much. It is tough to see her ongoing sadness, and yet I know there is no timeline for these things, and it's not something to be fixed.
Yeah, thank you. So being a caregiver or carer for someone who's in grief, that's a it fits so much of the bill that we've been talking about caregiving in general, of course. There's also something particular about it. Because the person you're caring for in some ways the person you're caring for is lost, or is caring is awash in feelings about someone who's no longer there. So you are sitting with someone amidst gigantic sense of loss. So your own understanding of grief will be really powerful. I really push you to kind of dig into grief as a subject and see yourself in it, because all of us have access to grief if we're more than a week or two old. So I would push you to be a student of grief. There's a lot of ways to look into it. There are a lot of our conversations. You can talk it out with grief support groups, with friends and family. You can read about it. Francis Weller's book, The Wild Edge of Sorrow, I think is a really good exploration of what grief can be. And there are many others. So becoming a student of grief so that you can understand what you're seeing in this person could be very helpful to you, and you can help you locate your own feelings in this mix. I think that's really key. And as you wade into it, my basic general sense for you, and I think you said as much already, which is so much the job for you, and with grief and tending to grief in general, is just holding the space, letting things be what they're going to be, not forcing thoughts, not forcing feelings, rather surfing them, riding them, knowing that for the most part, we're not going to get stuck. The fear with grief is people are going to get stuck. But those, in general, these feelings do evolve. They don't pass per se, but we feel differently about the situation if we're given enough time and space and love. So that, as you said, that's not on a clock. But your job is going to be so much you can't kind of force meaning onto this person. You can try like suggestions of getting bringing another animal into the person's life. It's a great idea, but don't conceive it of as a replacement, of course. Just a new place to go, a new dynamic, a new relationship. It may have been the wrong time for that particular intervention, but keeping an eye out for new things to try without sort of setting the person up to fail. Like, that's the hard part of grief. If someone is trying to help us kind of move through it, well, if we're not moving through it, then we feel like we're failing at grief and we're letting you down. And so your job, again, really is just to hold the space, not have any particular outcome in mind. Be careful of your own projections of what you think this person should be doing or thinking or feeling. That's part of your work. And hold the space. I know that can be a little buzz phrasey, but it's really real, rather than trying to force it, rather than trying to get her somewhere else. Back to bearing witness and seeing her for what she really is and what she's going through, and just loving her through it. That may be all there really is to do. The last comment, of course, is grief. Yeah, it sticks with us, etc. But there are times where it can tip into what's called complicated grief, substance abuse, or true depression overlays. So it may be too that this person really needs professional help, a therapy, a grief counseling, or a support group. And it also points to another message for you, which is this can't be all on you to somehow make better. You can participate in it, but it can't be all on you. So it may be helping her get help if you're suspecting that depression or complicated grief is in the mix. That's when we really do generally need help of a professional. All right, so those are my thoughts for now.
Great. Okay, last question. Regarding the mechanics of caregiving, what do you consider them to be? Is there a checklist of things to consider, basic things one should do? What's a good place to start?
Well, there's a couple ways to answer your question. I mean, there are, like we did today, like going over the activities of daily living, the sort of official regiment of things to do on behalf of someone else that you're caring for who's dealing with physical decline. But you may be caring for someone who is dealing with mental illness or depression and other things going on, not just physical. So I guess I would point you to start there, as to break it down between, and these are all clunky categories, but it more or less works. So what are the practical needs of the situation? Logistical, like is it getting errands done, cooking, toileting, accompanying someone to appointments, et cetera. So thinking of the practical things, the to-do list, breaking that down can be very helpful to kind of get a picture. But also the sort of, and another tranche would be the relational, the social piece. What relationships are in this mix to navigate? You know, who's doing what? You know, complicated relationships and families are common. So just naming that, and as a caregiver, being tuned into those dynamics, those social dynamics, can be very helpful for you to read the signals, but also for you to be supportive and is facilitating some of these relationship or communication back and forth. So you got these practical logistical issues, you've got these sort of social relationship issues. And then on the other, I think another bucket, big bucket, would be tending sort of the psyche and emotional, internal, the feelings that go with all this. And to be a good caregiver in this emotional way is being in tune with the person, being able to mirror their feelings, being able to kind of hold the shoreline and while they are awash and adrift, you know, just sort of navigating the feeling piece. That's where a lot of us get really lonely, is when our feelings don't get acknowledged. And we often, when we're uncomfortable or not sure what to do, we can sometimes blow past the emotional cues. So good caregiving can tune into those emotional cues and can meet people where they are. And by that, we mean emotionally, to the right sort of tone and key in together. So those are three big buckets to kind of break down the task in this particular situation. And then you might have a fourth bucket of other, like what isn't in those on those lists. It may be your own feelings, for example. So this situation may be priming in you old past experiences or fears in you. So self-awareness is a meta theme that goes underneath all these buckets. That's a good homework for you, and part of being tuned in and present with someone. So being aware of yourself, huge. And focusing on communication, huge. Really noting the lines, keeping the lines of communication open, figuring out how to hear people, making sure that your voice is heard too, so that you hear and you say what you need to, all of that. And that's really tricky, especially in a caregiving role. You've got the person, the dynamic with the person, you've got that person, their dynamics with others, and you've got the medical, clinical team, and that speaks its own language. So communication is another skill set underneath all of these. I'd say communication, self-awareness, the ability to sit with suffering that you can't change. That's another mega message here. So under whatever the particulars of your situation, I think those are the underliers. And then on top of that, practical, logistical, emotional, relational, as a way to break down the tasks and get clear on what you need to do in this situation. Okay, hopefully those answers are satisfying enough. But anyway, guys, was that the last question, Sonia?
Yeah, that's the last question. Can you introduce us to your furry friend?
Oh, this one is the Muffin Man. Hi, little buddy. Yeah. Say hi to people. Anyway, this is the Muffin Man. You haven't met Darkness. He's a rare treat around here, and you probably haven't met Maisie. Some of you, there's Maisie.
Oh,
Anyway,
perfect. Thank
family.
you for sharing. Yep, that's all the questions. Thanks so much, BJ.
All right, guys. Adios.